Ever wondered why your feet hurt at night? It's a question that's likely crossed your mind as you toss and turn, trying to find a comfortable position. Foot pain at night is not uncommon, but what causes it? Is it something you ate, a long day on your feet, or something more serious? This discomfort that keeps you awake can be traced back to several causes. Stay tuned to discover the 10 most common causes of nighttime foot pain. First, let's explore the tip of the iceberg of these causes. One common culprit of nocturnal foot pain is plantar fasciitis. This is an inflammation of a thick band of tissue called the plantar fascia, which stretches across the bottom of your foot. When it flares up, it can cause a stabbing pain, especially during those quiet nighttime hours. Next up is peripheral neuropathy. This condition is often tied to diabetes and affects the nerves outside your brain and spinal cord. When these nerves are damaged, they can send faulty pain signals to your foot, even when there's no injury. Tendinitis, our third cause, is simply inflammation or irritation of a tendon. It can occur in any of your foot's tendons, but it's particularly common in the Achilles. This inflammation can make your foot throb with pain, especially when you're trying to rest, and that's only the beginning. There's more to this than meets the eye. Now, diving deeper into the causes. Let's look at arthritis, a common condition that affects millions globally. It causes inflammation in the joints, which can lead to pain and stiffness, especially at night when the body is at rest. Next up is bursitis, an inflammation of the small, fluid-filled sacs that cushion your joints. It can cause a significant amount of discomfort during the night when your body is trying to heal itself. Flat feet or fallen arches can also be a culprit. The lack of proper arch support can lead to misalignment and pain, more noticeable during the quiet hours of the night. Lastly, we have gout, a type of arthritis caused by excessive uric acid in the bloodstream. Gout can cause severe foot pain that often strikes at night. Each of these conditions has the potential to disturb your peaceful slumber with foot pain. But wait, we still have 3 more common causes to uncover. Last but not least, the final 3 common causes. Let's dive right in. First up, we have edema, a condition where excessive fluid accumulates in your body tissues, often leading to swelling in the feet and ankles. This can cause discomfort and pain, especially at night when you're trying to get some rest. Next up is Morton's neuroma, a nerve condition that causes a thickening of the tissue around one of the nerves leading to your toes. This results in a sharp burning pain in the ball of your foot, which can be particularly bothersome at night. Lastly, we have restless leg syndrome, a neurological disorder that creates an irresistible urge to move your legs. This often disrupts sleep and can make your feet feel achy and uncomfortable. These conditions might be less common, but they can still significantly impact your quality of life. Now that we know the culprits, let's move on to how we can address this foot pain. So how can you alleviate this nighttime nuisance? Let's get right into it. Firstly, consider your footwear. Shoes that don't fit properly or offer inadequate support can exacerbate foot pain. Opt for shoes with good arch support and a comfortable fit. If you're someone who often wears high heels, try to limit their use. And don't forget about house slippers either. Make sure they're supportive and comfortable too. Physical therapy can also be a game changer. Exercises to strengthen foot muscles can help reduce pain and improve foot function. Stretching exercises for the Achilles tendon and plantar fascia can also be beneficial. But what about when you're not on your feet? Well, when you're sitting or lying down, try elevating your feet. This can help reduce swelling and discomfort. Medication can also play a role in managing foot pain. Over-the-counter pain relievers or anti-inflammatory drugs can help. But do remember, these are not a long-term solution and should be used responsibly. Importantly, lifestyle changes can also make a big difference. Regular exercise, maintaining a healthy weight, and a balanced diet can all contribute to overall foot health. And last but certainly not least, if your foot pain persists, consult with a medical professional. It could be a sign of a more serious underlying condition that needs attention. Remember, you don't have to suffer in silence. Seek help if your foot pain persists. In conclusion, nighttime foot pain is a common but manageable issue. Remember, we've covered everything from restless leg syndrome to peripheral neuropathy as potential causes. And we've given you a plethora of treatment tips, from regular exercise to using a foot bath. If you're experiencing this issue, don't be a silent sufferer. Reach out to a healthcare professional to get the help you need. Remember, a good night's rest is not a luxury, but a necessity. Don't let foot pain rob you of that. Good night and sleep tight.